All right, Dr. Gentwright set us up nicely about transformational relationships in order to build a city, a county that's all around how we are excited to bring our families here, grow our children up here. We have to ground in that relationships. It takes that. And today we're going to talk a little bit about how we are showing up for young people in our respective spaces and sectors, whether that's higher ed, whether that's K-5, whether that's early learning, mental health. We can't get to any other space and area for our young people until we talk about that first. And so that's part of the healing. And so today we're going to dig a little deeper into that. I'm going to invite my panel up. We won't do long introductions, but you guys can find their bio inside the program. So Ashley, Stephanie, Brandon, you guys come on up. Just give them a hand. I'll have them introduce themselves. Miss Sandy's in the house. Come on, y'all. Unfortunately, Dr. Ivan couldn't be here with us, but he's sending his good energy, and we'll catch him on the next panel when we get started. Y'all can sit anywhere. Cool. And in a little while, like I said, I'm going to introduce my granddaughter. She's going to ask the panel some questions, you know. I always feel like you can't talk about centering around children and youth if you don't have them in a space. So you may see some young people called Seeds of Peace in here, helping you guys with some activities later. But young people need to be hearing what we're talking about when it comes to them. And so that's key and important, and let's just get into this conversation. Y'all ready? All right, so we'll start with Brandon. Introduce yourself,
Gotcha.
Where you're from, and then pass it on to Miss Sandy, and we'll just go down the line.
Thanks, Farron.
Yep.
Brandon Irvin, good mid-morning and afternoon for some of the young folks out here, and I'm looking at everybody out here, you are young. And most importantly, I want to make sure I acknowledge Farron because she said she has a granddaughter. She looks 21 still. I currently serve at Clover Park as an administrator at Lockburn Middle School. We'll be transitioning to Clover Park High School. But I am a Tacoma 253 through and through human. And for those who are in the servant leadership industry, I also have the pleasure to be married to Dr. Tafana Irvin. And I share that because as we talk about this resource and access, it's all about relationships and family dynamics. So we attempt to do our due diligence to lead by example, but also listen and hear from our community about the resources that are out there.
Yeah, thank you.
Why Brandon have to go first?
Right, now you got to follow that. Go ahead, Sam.
I'm Sandy Cooprider. I am a nurse and the team lead at New Parent Support Program at Joint Base Lewis McChord. Our work really centers around supporting military families with children less than 4 years old. We do a lot of home visits to make sure those families have the resources as well as just the relationships that they need.
Hello, everyone. My name is Ashley Mangum. I prefer she, her pronouns, and I am the program manager of pediatric mental health at Mary Bridge Children's Hospital. And Mary Bridge serves as the backbone organization to a community coalition called Kids Mental Health Pierce County. And that is a community coalition that's aimed at streamlining and coordinating behavioral health services for school-age kids here in Pierce County. And so it was so amazing to hear that message today earlier because as I was thinking about it, I'm born and raised in Pierce County. And having those transactional relationships has invested in me to stay in my community, to help build that community and transform those relationships within the work that we're doing. So it's an honor to be here and be part of this conversation today.
All right, thank you. Last but not least.
You know, it's tough going last. So, hello, my name is Stephanie Hopkins. I am a caseworker at the Tacoma Housing Authority. I work in a program called 2Gen or 2 Generation. I work in the social service wing of Tacoma Housing Authority, so we provide the crisis support and intervention for our housing authority residents. My program specifically is engaging our school-age kiddos and their families in goal setting, community engagement, and programming.
Yeah, I mean, it's phenomenal work. We love it. Housing, health, education, like all of those sectors touch our young people. Gas stations, libraries. You know, somebody's going to encounter a child or a youth along that pathway. And so if we're not all connected around the services and resources that we're bringing to the table, man, how can we say we're centering? So let's just jump right into the first question. They got the questions ahead of time, so just so y'all know. And you got 2 to 3 minutes, just saying. But here's question number 1, and it's kind of 2-part. What do you think we, the community of Pierce County, are doing well for our children and youth? What is concerning you around children and youth that you're feeling is urgent? So how are we doing? What are we doing well? And what are some urgent things that you see that our children might need? Let's start with Brandon.
Well, currently serving in the K through 12 sector, you know, the number one piece is teachers, right? Making sure that we have folks out there who are still interested in the education arena. And then within that, making sure that we have access and opportunities for our after-school programs. We've got a great partnership currently with the Metro Parks, Boys and Girls Clubs, YMCAs. But within that, what we're realizing is our parents, they need love and care. They need to have a safe space for them to come to talk to us about the challenges that they're having at home. And in doing that, some of our schools have opened up their doors to create community engagement centers and spaces. So I'm challenging a lot of us out here to think about how do we do the non-traditional things that happen between 8 and 3? What about that 3 to 7 period time frame, which is where those ELO programs are really sufficing to support our communities? Now, what are some of the barriers? We already know access to transportation, access to food. That's a big deal for our community members. Sometimes our students and our families don't know how to ask. They also don't know where to locate those specific resources unless they're right there at that corner store, that grocery store, that Boys and Girls Club or YMCA. So how do we remove some of those barriers to allow for them to see that it's okay to ask for help, but also just meet them where they are? It's no surprise, as you hear from a school administrator, we've got to meet our kids where they are. We also have to do that with our adults who are struggling. So as I think about Pierce County in general, we've got lots of wraparound services, but are we telling the story where that the non-traditional and the high transient population of students and families are actually able to touch that?
Thank you. How about Ashley?
Yeah, I think that's definitely a great question. And I think one of the things that Pierce County has done really well is, you know, we've really taken this collaborative approach and realizing that it's going to take a community level and systems level approach to addressing the needs of our families. We've seen that happen around child abuse, right, with the development of the Child Advocacy Center. We've seen that around domestic violence with the development of the Crystal Jetson Center. And so when we look at kids and we look at the siloed approach that we are trying to take to address children, it creates this siloed system, this fragmented system where systems aren't communicating with each other. And so it's been great to have Mary Bridge serve as the backbone of Kids Mental Health Pierce County and to see the response of this community in their collaborative approach. We've been able to develop community multidisciplinary team meetings that bring systems partners from all across the county to the table to talk about complex behavioral health needs that are facing our families. And I think we learned as a healthcare system very early on that we could not be the singular solution to addressing the behavioral health needs of our kids and families. We just couldn't do it. Our intervention typically ends when you leave our doors and you're discharged from the hospital. But once we took that community approach and extended that network, we create a larger safety net for our kids, right? So when we pull the schools into that safety plan, when we pull our managed care organizations into that safety plan, we create that stronger safety net. And it's been amazing to watch our community partners come to the table every month on their own time, having a community multidisciplinary team come together in 24 hours and seeing 18 different community partners from across the county coming together to say, these are our kids, we're all part of this plan, and these are all of our resources that we can collectively put together from all of our organizations, knowing how strained the workforce is, knowing how strained our resources are, but again, using that collaborative approach to really take ownership of saying these are our kids, and I think that Pierce County has done a really great job of being able to support that work, and I think we have some continuing work to do to strengthen that so it can be maintained and be able to continue to grow, because as much as we're still coming together, I know that there's amazing programs that families don't know about or don't hear about. So how do we create that single point of entry? How do families know when I need anything, this is where I can go? Not when I'm in crisis, before I get to crisis, because I'm part of this community, and community supports each other at every stage.
Yeah, I have this saying, I say it all the time, community is the recovery plan, you know, and we find ourselves sometimes in triage all the time, you know, trying to hold stuff together, you know, but that connectedness, that transformational relationship space, that helps us be able to get preventative, right? To be able to stop some things from occurring if we get up in front of it. So that's another piece of why that community is so key. How does this show up in housing? Like what's going well, what's not?
Well, many things are not because it's housing, but you know, there are a lot of things that are going well. My program in particular is something that is going extremely well, I believe, if I do say so myself, at Tacoma Housing Authority, and that kind of leads to what I think is going well in Pierce County. Thank you, Ashley, for totally stealing what I was going to say, which is collaboration, because that is essentially what our program is. We rely heavily on collaboration with community partners, and with that, I think I can also say innovation. You know, we see a need and we try and fill the need, and so I think of like Kids Mental Health, Pierce County, which is doing amazing work, and it's only, like a 4-year-old program? That's innovation. And so I think that is, with that collaboration and innovation, I think that those are two huge things that we can do in Pierce County. With the prompt earlier, let's make Pierce County like a great place for kids. I can't remember the exact wording, but that's it. For myself, I have 3 like very little ones, and I think Pierce County is a great place for kids. And so I think that if we lean into what we're already doing and just expand, the program that we have at Tacoma Housing Authority, we're hoping to expand with partnerships like Green Trike, who are bringing in brand new community partners that we didn't know exist. And so I think as we welcome people in, particularly in the Housing Authority where we haven't really been doing this type of work, right? Focusing on filling the needs of our families and our youth, and providing the programming and providing the access to resources that we are at the level that we're doing right now and have been doing for the past year, we're seeing huge change. And, you know, I think that with the funding, I was going to bring this up later, but I think that that's a huge piece of it. And so, yeah, I think that that's something that we're doing well, but we can always expand on.
Yeah. Sandy, last but not least, how does that
I
show
know,
up?
last but not least.
Yeah.
Well, I work with that transient population a lot that aren't necessarily going to be raising their families here and maybe remaining here, but they want to have good supports while they are here. And I think sometimes at JBLM, we've had some great collaboration with the counties around us, but then also that how to find those resources when we need it would be the biggest downfall. And I think what is really great is when we can have collaboration like this. I felt so honored to be even invited to come to this so that I can take back what I learned, because we will use that all the time with the families that we serve.
Yeah, awesome. All right, number 2, due to the pandemic, typical playful activities may not have been allowed or available to our children and youth. In addition, they're also burdened with racial trauma, loss, stress all around them, themselves, and those who are with them. How is that showing up in you guys' spaces right now? Yes, go.
I'll take this. Well, we just finished April, which was the month of the Military Child and Child Abuse Prevention Month, and that was a big thing in our program to have those campaigns. And I feel like, and so the military allowed us to open up our play group, and it was the first time. Now, I've been honored to facilitate a play group at the JBLM Children's Museum with Brittany Gauchi. Yep. And we do that for exceptional family member, exceptional family member program, so special needs families. And thankfully, those families weren't left out. Even during COVID, we were allowed to have that play group. But then about 5 or 6 weeks ago, I was allowed to open up another play group. And just to see those moms, many of them that gave birth during COVID, so far away from family, spent so much time isolated, you know, it was just so important to see them. Being able to exchange phone numbers or tips on potty training or any of those things has just been, you know, so great, because it's been such a stressful time, you know, I think for our families. And I feel like the work that I do is much more around building up the care provider, the moms, the dads that are going to be taking care of those little ones, to hopefully help them in supporting them and their traumatic past or traumatic present, whatever they're going through, because then they're passing that on to their kids.
Yeah. Go ahead, Brian.
Well, thinking about being creative. In the schools, we all know the pandemic shut down a lot of our extracurricular activities through sports. In the fall seasons, kids weren't able to sign up or even play. But what I've recognized is some of our schools have become very innovative in creating things like esports, online gaming, right? Which we all recognize allows for our young people to still be connected. But if in fact they're even invested in that coding aspect, now we get a chance to change the narrative of creating access to the technology arena. But even in that same space, you know, I think about one of the ideas that came to mind at our building. We asked the community, what is it that they really want and need at home? And they said first aid, CPR cards. So then we began to ask our school district, hey, can we just get a trainer to come in and do some family events to allow for those young people who are 10, 11, 12 to actually learn? So that if in fact there was a situation at home, they knew how to take care of it. Really that allowed for them to be physically active and engaged, but also connected to their family and their skill. The other aspect, as I think about kind of removing those barriers about the pandemic, we've got to also tell a different story. That yes, inside your buildings, inside the stores in the mall, you may not want to hug and hang out with folks, but when you're at home, you can walk around the neighborhood. And that's where those big parks come around, right? That allow for kids to go down the slides, to get on the swings, to have those hand sanitizer stations in place, so that then they can have some safety while enjoying their time outside. I will tell you, our community of young people, they're excited now because some of the pandemic things have been lifted, but they still have questions about what is it that I can and cannot do. And I think the resources that amongst this entire community here are beginning to share, our kids will start taking advantage of them, but we've got to meet them exactly where they are.
Yeah. What's your thoughts on that, Ashley?
Yeah, healthcare and the behavioral health system were significantly impacted by the pandemic. And one of the things that, you know, really resonates with me is that I think it's important to know that we were in a behavioral health crisis before the pandemic, right? I think it really highlighted and put light onto the strain that we were already seeing. That's part of the reason why we formed the coalition Kids Mental Health Pierce County in 2017, because Mary Bridge saw a significant increase in the amount of kids who are coming to Mary Bridge for a behavioral health chief complaint. When I say significant, I mean 400% is what we were seeing. It's not uncommon sometimes to come to the hospital and see more kids in there for a behavioral health concern than an actual medical concern. And so this is something that has been apparent in our community for a long time. It's going across the state and across the nation, so much so our governor signed a proclamation. And so what we know is that we see workforce shortages. It impacted capacity, how we access services, right? A lot of in-home supports that our families absolutely rely on were taken away pretty abruptly, right? Things that they rely on to keep that kind of natural flow to their family system. You know, we've had to transition to telehealth. Not all of our communities have access to internet. How do you access that service if you don't have transportation or you don't have internet? So we know it's not been equitable in the pandemic. And again, we would say, I would just echo that the pandemic didn't create that. It's just highlighting it and making it more transparent than it was before. And so again, I think that we're gonna have to really come together as a community and talk about those innovative and those collaborative approaches, because we know capacity is not gonna be the solution. We're not creating this workforce that's gonna come out of nowhere. We're not gonna have more counselors and formal systems, but we all can have a role in wellness for our kids, right? And what that can look like. So I think that it's really important to note that, that as a community, we need to look at those now fixes. What can we do? What's those low-hanging fruits? What can we achieve through community agreements, like coalitions like Kids Mental Health Pierce County and other great efforts that are happening. I think about Help Me Grow and all these other things that are really trying to take that collaborative approach and creating that streamlined system through the collaboration.
Yeah. So would you guys agree that, like, even with all of those experiences, traumatic experiences, like, to not be able to play in the midst of that is problematic,
Yes.
right? And I think, being able to tie to, we see a lot of the trauma that has happened in our families, our own organizations, our own systems, but to not be able to sit and play jumping jacks, or like,
Yeah.
jump rope, like double dutch, like, those things, like those are critical to learning, and critical to our young people. What's your thoughts on that?
Yeah, I think that at the Housing Authority, just like expanding on that, I think that play is also an escape. And so during the pandemic, what we saw at our properties was, pre-pandemic, kiddos were all over the place. We have playgrounds, parks, and then, of course, during COVID, they're empty, and not just empty, like taped off empty.
Right.
And so as we came back last summer with my program, we still didn't see kiddos coming out, even though we were walking around trying to invite them to come out and interact and interface with us. We brought the farmers market. My program was able to bring the farmers market out, and we were trying to actively engage with the kiddos to tell them that we were there. My program in particular, we do the crisis intervention and access to support and resources for our families, and we had been working from home since the start of COVID, and so taking that support and resource away, where a lot of what we did was in person, like home visits, things like that, had a huge impact. Part of what we did was, when there was and I think I don't have to, but neglect in the household and different things like that. So many things were just slipping through the cracks, and we knew that, but there was nothing that we can do. And so as we're coming back in, now we're trying to bring the kiddos out. We are still not open to the public, but we have special permission to do things like we brought tutors in. And so at first there was maybe one kiddo that would come, but now we have a consistent number of 15 kiddos at a time showing up. But not just that, kids are returning to our playgrounds, they're returning to our parks, they're engaging with the farmers market. And so I think that as we do we have to put in the work. We have to put in the effort to invite the kiddos back out and reassure them and their families every step of the way that we care about you, we care about your safety, but we have to invite them. We can't force it. And a lot of times when people think of the Housing Authority, I mean, the word is in the name, authority. And so we want to make sure that we let them know that this is all voluntary. There's not a penalty. We're not we're not penalizing you for, if you lapsed on whatever it may be. We want to help. And so I think extending that hand and extending the olive branch through things like tutoring, the summer programming that we're going to be having coming up, I think that that's huge, because what we saw during COVID was that when kids weren't out playing on the basketball courts and using the playground, they were putting holes in the walls in our building. And so when we offer things like tutoring, after-school programming, free fruit from the farmers market, we're showing them the alternative, and mentorship activities through the YMCA, which were amazing for our middle school youth. We're seeing a decline in the destructive behaviors and an increase in the laughing and the play, which is what we want to see.
Well, And, excuse me, but I think the social skills, like how many social skills were put on hold, especially when I think about, like the age group that I work with, where they weren't even exposed to other children, and so they don't know that give and take that starts to come naturally when you do play time. And I think play is so important because it is a child's way of learning and growing. It's the work that they have to do. I also think, like, even with my parents that I work with, because they were so isolated, they don't know how to play with their kids. They haven't been to play groups to see how the interaction goes. And so I think I've had to demonstrate even more, like, what it's like to play with your kid, because it just doesn't always come naturally to people if they didn't grow up around that.
Yeah.
And sorry, Farron, I kind of want to back up, though, to maybe a picture of, one, we've got to teach our adults and teachers tolerance, okay? That some of our young people cannot sit down for 2, 3, 4, 5, 6 hours and not play. The second piece, in Pierce County, specifically maybe Tacoma in the 80s, I remember that middle school sports were taken away. And for those who've been around in Tacoma, that's when a lot of our young people were in the juvenile justice system because they didn't have an outlet. And the data shows extracurricular activity, engagement, graduation rates increase, involvement in school activities, etc. So as we think about the play portion, we've got to give our kids something to do. But then we also have to be mindful of the demographic that we're serving. I remember reading an article, some young men were walking down the street, hoods on, having a conversation, but because there were 4 of them, law enforcement stopped them. Well, the reason why they stopped them is because the local park was closed. So the kids were looking for something to do, but they looked as though they were doing something inappropriate. So if we don't have those resources available for them to engage in and engage with, of course, that negative data of incarceration is going to increase. And we've got to remove those barriers for some of our young people.
Yeah, and I'm so glad that we have in our, finger snaps for real. We have some of our law enforcement partners, in the space that, want to engage and want to lean in and want to make sure how do we create those spaces for our young people to feel so it doesn't feel like they're being rolled up on, because they're just walking down the street. I'm going to invite my granddaughter, Amina, to come to the stage. Would y'all pass her a mic? Because this is actually leading into a really cool question she's going to ask the panel. Come on, little Diana Ross. Got it. Hey, how you feel?
Good.
You feel good? Tell
Yeah.
everybody, what's your name?
Amina?
All right, and are you going to ask some questions today?
Yeah.
Okay, so turn around and look at me. Right? So look, say, Mr. Brandon,
Mr. Brandon,
Yes, ma'am.
how do you like to play?
how I like to play?
How do I like to play? Well, first with young people and kids like you, Amina. But I think the biggest piece is getting outside, running, jumping, but also just being competitive, right? Having something that I can work towards and work to. Sometimes that also includes a chalkboard on the ground, drawing the best unicorn. My daughter right now, I think she's a little bit better than I am.
Miss Sandy,
Miss Sandy,
how do you like to play?
how I like to play?
How do I like to play? Miss Brittany has a really great bubble machine at the museum, and we work to slap and stomp those bubbles. I like that so much that I bought a bubble machine for my play group. But with my grandkids, we do a lot of road races. Do you ever do a 5K with your grandma? It's fun. You get a shirt, you get a medal. Yeah, and my boys like to run with me because I'm a run walker.
Miss Ashley,
Ashley, Miss Ashley,
how do you like to play?
how I like to play?
That is a great question. I am a new puppy mom, so I have a 14-week golden doodle who likes to play hide and seek with my socks, eats my plants, and thinks it's funny to run away from me. So we play a lot of fetching and training and trying to get Mr. Jameson from eating my socks and other property.
Okay, thank you.
Thank you.
Thank you.
Miss Stephanie,
Miss Stephanie,
how you like to play?
I like to play.
Well, I like to play how my 3 tiny kiddos like to play, and since there's a range, the things that we like to do right now are playing a lot of monster trucks, doing a lot of swimming activities, and playing with a lot of LOL surprise dolls. Are you familiar with LOL dolls?
Yeah.
We can't have enough LOL dolls. Don't tell them about Barbies. We got enough. But yeah, that's how I like to play right now.
Say thank you.
Thank you.
Are you gonna ask Gigi how I like to play?
I like to play, Gigi.
With you? With you? But you know, our family like, she's laughing because sometimes I'm tired, but we like to do family game nights, and I have another daughter that's in the space, but we love to just be in community with each other, with our own family, and play that way. So thank you for answering that question. You gonna make it down those stairs, okay?
Yeah.
Oh, ask Ms. Lee to help you down the stairs. Thank you. All right, last but not least, here's the last question. What's one thing you would ask the people in this room to do to make a real difference in the lives of children and youth? One thing you would ask this Pierce County family in here, what would they do to make a difference in the lives of children and youth? And hi, Stacy. Go ahead.
Become a teacher.
Right.
But I think in that same space, continue to be servant leaders and really just ask the young people around you, what is it that they need? And really be a listening ear.
You just go down the line.
I think a listening ear is super important. And so people in this room, I think, you know, one of the things that I think I use the most often in my work is, how is that for you? You know, not assume anything, but find out people's stories.
I would just challenge everybody to, this is gonna sound corny, but put the we in wellness, right? Like, I think about my experience growing up in Pierce County, and I never saw a therapist as a child growing up, but I had the Eastside Boys and Girls Club. I had Coach Wright. I had teachers at Mount Tahoma that kept me accountable all the time. And so that kept me accountable and kept me, when I had those, you know, adversities and challenges, you know, able to function and go to school and go to college and all those experiences. And I remember those people who were pivotal in my development and my growth. That wasn't a counselor, that wasn't a psychologist, but people who showed me that they cared about me. And I think we all have opportunities on a daily basis to show a child that we just care, even if we just recognize that we saw you today. Hello, how are you? We hear you today. I hear what you are saying. So that would be my suggestion.
So I think there's 3 things. So one would be, of course, like, ask the youth what they need, listen to the youth, invest in the youth, invest in youth programming, but also, like, as you're asking youth what they need, pay them for their opinion. And, you know, I think that really it's about putting your money where your mouth is. We talk a lot about, like, youth engagement and what the youth need, but we need to start, you know, spreading the dollar resources that way as well. And then the 3rd thing would be, say the thing. Speak up and use your platform to advocate for youth and youth services. And I told Ashley that I was going to do this. But Ashley and I went to college together, and so this is like a really prime example of why it's important to use your platform and speak about the resources and the needs of our youth. She
She told me she was gonna do that up
I
here.
totally told her that I was
Let
going
me
to do this.
scoot back so I can make sure.
And I talk about this a lot because it's a prime example of why it's so important. Ashley was a social worker for DCYF or CPS before it became DCYF. And I was working in social service and totally removed from foster care. But she just, was blasting out there, there's a crisis in foster care in Pierce County. I had no idea. Like, didn't work in that field, wasn't associated with youth at all, but I was in a one-bedroom condo, and I'm like, maybe I can help. Now, however many years later, I've adopted 3 kiddos from foster care, and it literally was because, and it was only because Ashley was posting on social media that we're in a crisis. I had no clue. And so it's really important to use your platform to advocate for the youth because it can have real, tangible, you don't even know about it. I didn't tell her that I was like becoming a foster parent. It wasn't a conversation that we had, but I did because she put that out there and it like put that thought in my head. And so it's really important to use your platform and advocate for the youth.
Yeah, I mean, ditto everything. What I would love to see folks in this room figure out how we center around children and youth is those key components like listen. We've been working with young people, through Seeds of Peace, and they're a group of young people that come together every Friday night, from 6 to 8, and sometimes they keep saying they want some sushi. I haven't graduated to that part yet. But we get pizza and we get sandwiches and we talk about what's going on in their world and in the spaces and what types of supports that they need. And they have felt like they haven't been heard, even though there are lots of people around with ears, but they don't feel like it had resonated yet, And so you're gonna hear a little bit about a project, I'm just kind of prefacing it now, called Project TAT, Teens Across Tacoma. And it is young people across Tacoma schools that are really working towards how do they support their peers who are experiencing housing insecurity. That might look like a youth night. That might look like get your hair cut. That might, they just wanted to pay prom for 2 McKinney-Vento students to go to prom, at each of their schools. So little things like that, if we can resource that, and that stuff is not cheap. But we all collectively here have enough to be able to resource and pour back into our communities to help our young people. So I want to let's give our panel a round of applause.